if you see me in person and you're one of these people that aren't doing it right, you better keep your eye on my right foot.
Told you he could do something stupid, folks. There we go. His trick for the day.
I did it.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
This is Smythe Duval from Marietta, Georgia, and you are listening to the Help Me with HIPAA podcast.
Welcome to episode 304.
Boom.
Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me is Donna Grindle of Cardin. Good morning, Donna.
Good morning, David.
Well, afternoon now.
Yeah, I know. We've had power problems. Okay, I mean, it's just been a day. And then we went down the rabbit hole of what we're talking about.
Yes. Yeah.
So we're real excited in a bad, well, I hate to say excited, but we are because there's a lot to say.
Yeah. So we started out today going, we're going to cover a lot of these privacy questions that are coming in from listeners and some other stuff. And then all of a sudden in the middle of that, we discovered there is an active ransomware attack on a healthcare facility in the U.S. that is on social media.
Yeah.
And what a rabbit hole that is. And so we want to take you down that rabbit hole with us because we talk about these types of things all the time about what's going to happen when your practice is going through a ransomware attack and how does that play out? How do your patients feel about it and all that? Well, guess what? We can read all of it happening right now.
Right now.
And we don't have to make any assumptions and you don't have to go, well, yeah, I know you say that, but no, no, we're gonna show you, and we're gonna talk about some of the things that people are saying and give our commentary on it. But we're gonna show you how this is a crap storm to deal with when it happens to you. And I am
in so many ways.
It's bad.
All right, yeah. We can't even tell you how bad it is. It's so bad. You haven't made a word yet.
Yeah, crap storm's the PGest thing I can come up with. It's bad. So before we take everybody down that rabbit hole, do want to mention that the HIPAA Boot Camp Virtual Edition for August 17, 18, and 19 is open for business. So if you want to get in on that, it is filling up quickly. So head on over to thehipaabootcamp.com for more information about that.
Yeah, you need to get, because we've never had it this full, this far out.
Yeah. Yeah, that's crazy. And normally it's, the last couple of weeks, people start jumping in real quick. But no, we get them in there.
Good. It's awesome.
Yep. All right. As always, thanks to our donors, and we do appreciate your support. And for those of you who are sharing out the podcast and leave us some reviews and all that, thanks, and continue to do that. We definitely appreciate it.
We need it.
All right. So that brings us into our first question coming from George.
Well, wait, though.
What's that?
HIPAA. Say what?
I was waiting on you to do it.
All right. Yeah.
So, yeah, HIPAA Say What segment was going to come from George this week. Hey, George. Donna and I both know George. And George has been to the boot camp and all that good stuff. So, we had an episode in 302. We talked about getting your patch on and patching systems and all that stuff. And so, George writes in response to that, "Hi there. Thanks for the episode. So what about SolarWinds, where the hot fixes were infected? We got lucky where we did not apply the hot fixes and the network was not compromised. I believe there needs to be a balance based on risk assessment on which critical assets needs updates and the timeframes." So
we agree. Moving right along.
Yeah. So the question being, what about SolarWinds and what happened there, and how does that affect patching? And my response to that is you can't not patch based on what happened at SolarWinds, and to some degree you're kind of screwed when somebody is is infiltrating the actual supply chain of the code. But I also think that gives rise to looking at what type of protections you have in place, and are you using AI behavioral based protections? Because I think that's where you're going to get your biggest value. Because in the past, and even currently, most IT companies and IT people on staff, they're looking at what you do day to day. For example, let's say you're running QuickBooks. They're going to say, okay, QuickBooks is a known application, just whitelist it. And so everything QuickBooks wants to do, let it do it. Let it update, let it do whatever. And it just whitelist everything, because honestly, it's the easiest way to do it. But when you look at something like what happened with SolarWinds, and it could certainly happen to QuickBooks or any other application, you have to have your protections that are not looking at the software, and they're not looking at whitelistings and all that. It's looking to say, does this software do what it's supposed to do? Is it doing what it normally does? And are those things okay? And the only way you can do that is through behavioral-based technologies that are out there.
Okay, so to add to that, the big issue, though, is being very careful on those decisions, because the SolarWinds app, that was a technical app. I mean, it was like very specifically technical, and there are a lot of assumptions within the technical community about, should I not? And so then they either take one or the other. And I think George's point is you've got to be in the middle, and you have to evaluate what is the fix really about. But now keep in mind the NotPetya ransomware attack that spread all over the world not too many years ago came from an infiltrated update to a payroll system used in the Ukraine.
Right.
They did not intend for that to spread around the world.
Mm-mm.
Yes. So you have to evaluate, if you don't have the AI and behavioral analytics stuff, which, by the way, David does, and he's very happy about that.
No, I'm very happy about it, because that's when when the news about this broke, one of our security vendors, and we use a stack, so it's not just an app. We use layers and layers and layers of protection. But one of them emailed and said, our solution stops this, and it's not just us saying that. We have evidence that it is currently stopping this. And so, we were happy to be able to send things to our clients and say, not a problem.
Yeah. But if you don't have that, then it requires the manual effort, especially with, big ticket items that could have major impact. So your EMRs and even, again, QuickBooks and those kind of things. But just know that you would not be the only one. This, if QuickBooks or Adobe or whatever's hit, it's usually really quick and all over the place. It doesn't have time to propagate. All right.
Yeah.
So, yes, George, and thank you for pointing that out. We were probably rambling and did not point that out. Otherwise, you would not have mentioned it, because you're that guy.
Yeah.
We love that.
Yeah, he's the so what about guy.
You didn't say. All right.
But this is the perfect way to say you should always be thinking about things and looking at, well, what about this and what about that? Because that's basically what he's doing is he's doing kind of a risk assessment. So what about question is a risk assessment type question.
Yeah. Well, and I just this week was at in a client meeting, and I'm like, well, what are you doing if this, and this happens? And one of them goes, I just can't think like a criminal this well.
Yeah.
I'm like, yeah. I was like, yeah, I love that part of my job. And Carla's like, yeah, she loves it.
A little too much.
Yeah. Well, the halo bangs Carla in the head, so she's not allowed to. She can't do it. But anyway, yeah, you do. You have to think about those things, which is a perfect segue into what started the notes for this session, where I got down the path about privacy questions. Was Allison, who's been a listener and interacted social media for years, mentioned on LinkedIn when we were talking about one of our episodes about, which one was it? Hygiene. Now I don't recall. But anyway, she asked, what about the folks, the new laws that in order to get a mail-in ballot, you have to send in a copy of your driver's license. You know, what does that mean? And I'm like, I'm in one of those states and I have been freaking out about it ever since. Because it is one serious problem where just the thought of, there's no plan on managing those things. What are they going to do? Are you going to guarantee to me you're going to shred them? And that somebody isn't sitting there throwing one to the side every few minutes. And then and if you keep them so that you can compare signatures later, where are you going to keep them? Are you going to put them online somewhere? How are you going to store them? So yeah, you need to be thinking about, prove to me, whoever I have to send this to, what's going to happen next. I did an event at one point, and you came in and you registered and they wanted the date of birth. And I'm like, why? You don't need that. Not for what I'm doing here. So yes, you should question everything. And another part that I had been reading was about the new Apple tags. Mm-hmm. Great news. They work really well. Bad news. They work really well. So it is a rabbit hole to go down about how they work and what they do. But the big concern is that those will be used effectively. And there's a lot of reasons to believe it would be very easy to use them effectively for stalkers, domestic abusers, all of those kind of things in a very negative way. And not something that would require a lot of effort or thought in order to implement, let's just say. Mm-hmm. That is a very scary thing. And it also means that the way the thing works is it tracks your location and it uses connectivity to, if I have one on my gear and I walk by you, it might ping out to your phone and go, hey, where am I? And your phone would answer. That's how it works. It just asks, where am I? From another Apple device. So if it finds another Apple device, it says, yo, where am I at? And it tells them. So whenever it can find another device, that's how the tracking kind of works. It's a very simplistic, explanation, but knowing that your phone could be telling those things where they are. And, if it actually connects then and starts tracking you get a notification on your phone within a certain amount of time. But if you have an Android phone, they're like, it's 3 days without a connect. It'll tell you, okay, that's way too long. So anyway, lots of privacy concerns in there, bigger issues, went down that. Then stuff about hackers targeting cash sharing apps. So Zelle, Cash App, Venmo, blah, blah, blah. They're not targeting the app itself. What they're targeting is people not securing and using the app properly. So let's be clear, the apps themselves, not necessarily always the problem. Mm-hmm. For all of the cases that particular article covered, in every one of those cases, the user gave up information.
Yeah, this
have it.
Actually happened to somebody I know.
Yeah?
Yeah. And I don't know if I mentioned it on the show or you and I just talked about it, but it's my barber. And I went in for a haircut. This has probably been a month ago or maybe 6 weeks ago. It's been a little while. And she was telling me she used Cash App and somehow somebody sent her an email and she ended up getting on a phone call with somebody who had her doing all kind of stuff on her phone. And next thing she knows, she's getting alerts from her bank saying that she just made withdrawals. And
Yeah.
Anyway, the so far the end of the story is I think she got left with $17 in the bank.
Whoa.
And it was a business bank account. They cleaned it out.
Mm-hmm.
I didn't ask how much money was gone, but
See, this goes through one of my rants about a lawyer telling somebody that it's okay to use those apps to collect medical payments because the patient is choosing it. And I'm like, there's so much more. But, the lawyer knows about technology. I mean, they were like, it's not. And I'm like, yeah, but there's more. But anyway, yes.
Yeah. So if you're using any of those, you definitely got to be careful because this is access to your money. And the apps themselves may be secure. But
I will say I use Zelle.
Mm-hmm.
It was created by the banks. They have a certain level of security requirements, those kind of things. The others, I didn't feel as comfortable. So I'll just say the only one I use is Zelle, and I'll leave it at that after my research. So
yeah, but any hacker will tell you it is a lot easier to hack the user than to hack the technology.
Mm-hmm.
So that's what people do now. The whole thing about ransomware, it's not hackers hacking technology, it's hackers hacking humans.
And
so
then just opening the door and letting them in.
Yeah.
That's what it is. That all that social engineering and making people understand you do have to think like the criminal.
Mm-hmm.
And that's how we end up opening the door in every one of those cases. But there was one which I do have to bring up because we talk about it all the time and everybody's like, that doesn't happen. Let me tell you what happened. What had happened was a woman reported this whole thing. She was out of the country. So especially to note, out of the country, connected to hotel Wi-Fi, did some banking. And she said, basically they were coming right behind her and they key logged everything she did and then wiped out her bank account. Now, yeah, she was using the app, but the app didn't do anything. You didn't have a VPN. You didn't do these things. So if you can't be sure that you are securing things properly and putting proper authentications in place and VPNs and all those kind of things, you shouldn't be using the apps.
Yeah.
But don't blame the app, blame the user most of the time. Although we did just talk about the app being impacted by George's question. So
but you're right. It's most of the time. It's not that SolarWinds type things can't happen. It's just that compared to how many times a user gets hacked, I mean, it's
there's been millions of those just in the time we've been talking around the world.
Yes. You are correct.
All right. So now we get to the good part, the juicy part.
All right. Are you ready
This
for this?
is how ransomware can create a social media privacy violation storm. I mean, it is bad. It's very bad.
It is.
It's
so,
bad. You want to start with what had happened was.
So there's a health group out in California, right?
Yep.
Okay. It's Scripps Health, so SCRIPPS.
It's a system. I mean, it's a ton of hospitals and practices and all the clinics and everything.
And the article was that there's a hack that's forcing appointments to be canceled. And so
because everything's a hack.
Yeah, everything's a hack. And so, we're like, okay, let's see what this is all about. And we start going down the list here. And, not only is it talking about it's a ransomware attack, it's ongoing, it's been going on for days. Everything is shut down. Like technology-wise, down to their website. Gone. Shut down. Can't even get to it. And so as we're reading this article, we start seeing where the news has talked to patients, and patients are giving their opinions about the incident, which are very telling, which then led us over to Facebook because somebody said, that people are posting on the Scripps Health Facebook page. And that's where
Oh, it was like,
oh my goodness.
we're like, did you see this one? Did you see that one? Oh, and David just said, we need to just start reading these and talking about them and just record. But here's what led us in. The quotes in the article that were first leading us in was what the patient said. And we're like, this is what we tell people, right? Is that patients have had their appointments canceled, and it mentions one specific patient. The repercussions could be worse than what I expected, maybe, because he was supposed to have critical surgery for treatment for a rare muscular disease that he suffers from every day, and the surgery was canceled, making, he's not having that, and his medical history is inaccessible, so he knows nothing. And if this rare disease, if I were to have a crisis, I'd have to go to the hospital. My concern is medical records are really extensive, and I wouldn't have access to my history, and that's kind of pertinent because of my thing. So now he's trying to write everything down in case he needs it.
Mm-hmm.
So that is a big note for you to put into your planning of, if you treat patients with chronic disease, what happens if you can't get to those records and they need help?
Well, it's probably worth mentioning, because you brought this up when we were talking about it, that, writing down all your medical records is great, or having quote unquote photocopies and stuff like that. But if you go to another provider and you're handing them handwritten notes or photocopies of stuff, I mean, they're not likely to really consider that all that much, because who knows if it's accurate.
Mm-hmm. Yeah.
And so you have, you've got another problem to deal with.
And so this brings us around to the whole thing with information blocking and interoperability that we're trying to solve for. But that's so far from being, it's in its infancy almost, which means we have to deal with these somehow. And then the other patient, unable to get his medication right away, was contacted to pick it up a day later. I've been on this medication for 20 years. If I had not taken it for 2 days, I would have gone in a coma and died.
Wow.
Yeah. So this is not something to play with. But then we went to Facebook.
That's when I read that about that guy, I'm thinking, dude, I'd have like a 30-day backup supply if it's that critical. That's a little close call for me.
Oh, yeah. I was on one of those medications, and they said, you have to stay on schedule. You have to be exact, or it could cause you to have a stroke, or a seizure. It was a seizure. And I'm like, first of all, not sure I'm happy about taking this, but it's when I had nerve damage stuff. Mm-hmm. But to do that math, it's very stressful. And then to not have the meds, I can't even comprehend.
So these patients are worried that the hack is going to lead to more problems. And the article says people have vented their frustrations on the Scripps Health Facebook page.
And so we went.
And so we dove into the rabbit hole. And as of right this second, the last post was 15 minutes ago.
Yeah. Yeah. It's like, well, the one post had 145 reactions. I do not understand why some were thumbs up, because Facebook has plenty of other options. The crying person, the oh my person. But 217 comments, 67 shares. Or
221 now.
Oh, yeah. I haven't updated.
You got to refresh.
Oh, geez. So anyway, there are so many comments in here that it's beyond just the patient problems. Now we're getting into serious privacy issues.
Yes.
Yes.
Brand damage. We talk about that.
Mm-hmm.
So let's see what some of these people have to say.
Oh, it's 222. I just refreshed.
There you go. It's ongoing.
It's 2 minutes ago. Right. Yeah. So anyway, whoa. So I got to get them all back open here because there's so many. It takes a while to open them. But there are multiple things that we could talk about this in so many different ways, right? Because it is about all the things that you should be thinking about in your incident response plan.
Oh, yes.
There are plenty of things in here.
Oh, yes.
Which clearly communication with patients is something that we say should be in your incident response plan.
And we always say you better have a plan B and a plan C for communication because it's super important. Because if you don't figure out a way to communicate with your patients, they will figure out a way to communicate with you.
And and they'll tell everybody else about it.
Oh,
and
yes.
They'll tell two people and they'll tell two people. So they do say that, all right, so this was posted, so it all starts May 2nd at 3:31. Okay. And that they were hit late on May 1st. So here we are on the 7th as we record this. It's still happening, clearly. But the whole paragraph, and they talk about this has happened and we're doing this and, you know, we're utilizing backup processes and offline documentation, also known as paper. But then it gets down here at the end. We're going to postpone things. You'll be rescheduled. You will need to reschedule. Okay, that's one, because you hear a lot about this in just a minute. Our technical teams and vendor partners are working around the clock, which we know they do. They've notified law enforcement and governmental. So we know the FBI's in here. We know a lot of things are going on behind the scenes. We're well aware of that. And then this paragraph. We want to reassure our patients that our physicians and employees are well trained and thoroughly prepared to respond to this sort of situation so that we can continue to care for the community's healthcare needs. Now let's proceed.
With that in mind, let's show you the evidence, the evidence of that statement.
Let's just start with, I don't know, one of the first ones here. A patient says, I need to know what time my appointment is on Monday. Nobody is there to tell me anything. I go to my emails and guess what it says? Log into Scripps. So that's not helping me. What time is my appointment? And Scripps Health replies, and this is when we were both like, uh-oh. Scripps Health replies, where is your appointment? In the middle of the comment thread, the patient then tells us the La Jolla Gastric GI on Genesee at the hospital. My husband thinks it's at 9:30, but I'm pretty sure we're in PHI territory. Pretty sure.
Yeah, I'm smelling some PHI.
Yeah. And and they say, mentioning the patient's name again, Mindy, that's what we would. So if all else fails, I can try calling the hospital. Maybe they can help. And so Scripps Health says, yes, Wendy, that's what we would suggest. Please stay tuned here on Facebook for updates as to when systems will be back up and running. Thank you very much. That was very friendly. That was 4 days ago. So things progress. I sent this via message because I'm not sure if you answer those. Lovely folks. Everybody's so nice. I'm sorry this whole tech thing is hitting you so hard. Hang in there. I have a colonoscopy on Wednesday, and I'm a bit anxious. So, but anyway, Mindy then replies, Mindy, the previous patient's PHI.
So now patients are talking back and forth.
Tells the other patient, I've just been informed the GI department should go to the hospital or to emergency if you're having a problem. So now the patients are providing information to each other and sending hugs.
I'm sorry to laugh.
I know, but I mean, I know it's very bad and serious.
Yeah.
However, this is what happens if there's no plan, no secure message. But clearly somebody noted, because later A lot of people with GI scripts were on top of this. But then, shortly thereafter, somebody went, you shouldn't be talking to them about their, don't do that anymore, right? So then Manda, we have Mindy and Linda and Manda. I have a GI procedure tomorrow. I don't know why all the GI people are on top of this, though. And what should I do? And Scripps Health says, are you with me there? You see what they say?
Yeah.
They're like, oh, contact the hospital. Then they realize, well, here's our better answer.
No.
Yeah.
Don't say it.
Hi, Amanda. Please send us a DM with your full name, date of birth, procedure location, and doctor name. We will do our very best to have someone contact you directly.
Translate that for you. Please send us your PHI over a direct Facebook message, for which we have no BAA in place.
Which they would never have one. It is not a secure method to communicate with patients.
God,
I am now handing out what I need, everything on Facebook.
Yes.
So I'm not having the conversation. I'm not making the mistake of asking for all the information in the conversation. But now I'm going to have it DM. And they proceed from that point forward to say, please DM us with your information.
Yes, that doesn't stop all the way up until today when we saw they were still saying, please DM us. So now, on top of your ransomware that's likely a breach, you now have more breaches that you are creating.
Well, I mean, you know that this one's going to be looked at by a lot of people.
Oh, yeah.
Not just us right now. There's going to be so many post reviews of this because clearly there's some serious stuff going on if it's been down this long and we're still seeing nothing coming back up.
Yeah, yes, but you and I know, and this is something that the business / healthcare community needs to understand. We know that when things like this happen, it's not a quick fix. It's days.
Even if you are able to restore.
Right.
It's not fast. And if you pay, it's not fast.
No. And, us IT people, we go out there and we're selling business continuity services. And one of our sales pitches is, have you back up and running within hours or minutes, depending on what you want to pay for. But when you have a ransomware attack, sometimes that's not the case because it's not a matter of we can get you back up and running. It's a matter of we have to preserve evidence. We have to do things in a certain way before we can get things back online. So you've got two things. You've got the let's rush to get everything back up and running and we have to make sure we fully investigate this properly. And those things often are not going in the same direction.
Yeah. That is absolutely going in a lot of directions as it is right now because there's further conversations that say that the backup was also impacted and they can't restore. So
who knows that though?
I know because there's plenty. Here's the best part. There is a lot of other information besides patient stuff going on here because let's review. The staff knows how to handle this and we know this because a message. What about employees? I can't access Kronos or my email. Is that affected too? And somebody replies, everything is affected. No one can log into the computer system. And then somebody else says, business office 45 Rancho is also closed. No data given for us to start or come back to work. Most of us are working from home.
Okay, so now we have employees that are giving updates to the situation on social media.
To each other.
Yeah, to each other.
There you go.
For everybody else to read, the media.
Like us.
Us. I guess we're media. Patients. So now, in addition to the patients trying to find a way to communicate with the office, now the employees are trying to figure out how to communicate with the office.
Yep.
Which, by the way, let's recap. Because just 5 minutes ago, we said, we want to assure you that our physicians and employees are well trained and thoroughly prepared to respond to this sort of situation.
Yep.
Okay. Maybe not everybody. Obviously, there are at least some who are not well trained and prepared to respond to this sort of situation.
Yep. And so, and this gets into, here's the next one, where you say even the website's down.
Mm-hmm.
And it could be the portal they're talking about. I don't know. We didn't go investigate. We got too far down reading all these comments.
Well, I did go to the website and it doesn't pull anything up.
All right. Well, there you go. All right. So your website is still down and it's been 2 days. When will we be able to access your website for information? Scripps Health says, we are actively working to restore our systems as soon as it is safe. We are working with the top global experts in the field of cybersecurity, as well as local and federal government. Systems will be restored as soon as possible. And then some other patient says, how long is as soon as possible? And then somebody else says after that, yesterday, somebody pipes in because Scripps Health never answered how long as soon as possible. It's been 4 days and I need to have my stat tests done that were canceled. How long? Mm-hmm. And somebody else pops in. This is where we start getting the information from technical people. Somebody else pops in. It's really impossible to say. It's not as simple as restore from backups with a database that size. And the person says, well, we need an answer soon on what we're looking at here. If it's that big, are we looking at weeks, months? Find another medical center. This is all starting to become uncertain.
Yeah. So now, you've got all these people that have now become the project managers to respond to this incident.
Yeah.
And like this one lady, she says she's worried if the patients and staff have their personal information compromised. And when will we be notified if our information has been compromised? To which I would say probably day 59.
Yeah, count 59 days from now.
It won't be on social media, hopefully. They won't notify you that way. But secondly, it won't be anytime in the next few days. Yeah.
And so here's somebody on Saturday, I received 2 checks that were refunds from Scripps. On Sunday, there were 5, quote, voucher refunds credited to my bank account. I have no idea why either checks or refunds would have been issued. Is this part of the breach? And then, can you please DM us? I also received a refund for $15 on April 1st. Not sure if that's related. April 1st. Maybe April Fool's Day. I don't know. But now you're handling billing and financial questions on Facebook DM. People are just handing out their own information. I have an appointment with Dr. So-and-so on May 5th at this medical center. Patients don't realize what they're doing. They're panicking because there's no process.
Yeah. This lady's like, I feel you. I've been waiting a month for my appointment this next week, and I can't get this done. And, what else do we have going on here?
The colonoscopy people that have been fasting and getting ready for their procedure.
I know.
And they can't find out whether or not that they can do it. And I'm like, I would just say, I'm going to assume no if I read through all the GI discussions. But, and the retired IT professional willing to volunteer if you need more hands on deck to restore. Message me if IT management could use, and then goes on. And then of course, immediately somebody says, given your experience, maybe you could give us a ballpark on what to expect.
Yeah.
And the guy's like, I got nothing except what you're reading.
Smart of him.
But, I read the criminals also managed to sabotage the backups. It looks grim. It may not end until the FBI drags the culprits away to spend the rest of their lives in prison and suggest 100,000 counts of reckless endangerment, consecutive sentences. If they have to rebuild their entire system from scratch and populate the database from paper records, that's a huge effort, which some volunteer effort might help. But Brooks Law of Software Engineering says adding manpower to a late software project makes it later. So, but then people are still coming in and asking this person, but I'm trying to find the one that was the best one. Well, and then these are the scary ones. I missed 3 CTA and CT scans for an aneurysm. No one's called to tell me when I could come back. People are terrified. And this is really, that's not funny at all, how scared they are. But they say it's reprehensible what people will do these days, putting innocent people's lives in danger. This is a big problem that people don't understand. Mm-hmm. It's not like there's one dude in a basement doing this.
Mm-mm. And the more people are freaking out, the more the bad guys are going, yeah, this is good for us.
Yeah.
Yeah. There's a higher likelihood you're going to pay, which, a lot of people in here going, just pay it, just pay it, just pay it. I'm like, it's not that simple.
Even if you paid.
It is not that simple.
No. And that's what a lot of people don't get.
Yeah.
Oh, here's the one. Here's the one that knows all about paying and why. All you have to do is pay. So we'll just say Sharon says, if you pay the ransom, they're pretty surely going to get all the records back. For the sake of your patients, pay the ransom. And they're like, yes, this is what needs to happen. It's getting scary. And then Sharon goes on an entire dissertation of a very long post about, while there's no guarantee if you pay that you'll get the data back, it is a chance. And then says, I took the chance after emailing with them, meaning she's had ransomware attack.
Mm-hmm.
I took the chance after emailing with them and pleading my case. I got everything back. All my documents, photos, everything. It was scary. My computer repair guy helped me with all of this, and it was the first time for both of us. I was lucky. But the only thing to do is pay the ransom. So many are affected here and in dangerous health. They should pay the ransom. They have failed their patients by not fighting for these things. Okay, so here's the thing. Even if they paid the ransom, there's an article that we're going to cover next week, which is going to be about ransomware. 92% never get all the data back.
Mm-hmm.
No, to say you should stand up for your patients. I mean, there's life and death situations here. They understand that, but I don't think so many people who are on here full of technical knowledge, making sure they're telling people, about how to manage their security. Very few people actually understand how complex this is. And it does remind me about, there was another health system that got hit with ransomware last year. And we had a quote from the president in an article that we talked about in an episode where he said, if you had told me it would be like this, that it would take 6 weeks, I would have told you there's no way.
Mm-hmm.
I think some of these people should read that.
Here's a post from a lady. This is pretty heartbreaking.
Mm-hmm.
She writes, I'm really needing to get my medical records to be sent to the hospital in Stanford for neurological surgery due to my rare progressive brain disease. The only way I can get this done is for Scripps to send my medical records. I've been through so many tests and procedures that I wouldn't want to go through all over again. Please, this is the only way that can save my life.
Yeah. We're no longer, here's somebody that had a biopsy and they can't get the results to know what treatment to take. They're terrified.
Mm-hmm.
I know what it's like when people go through those biopsies and are waiting to get the answer so they know what step to take. And then more and more are now joining in. They've had a bad diagnosis. And we can't get information. We can't get the care that we need. And at this point, I haven't even, they're actually, it looks like that they have stopped replying. It's gotten so out of control. And then somebody asked, What about hackers gathering our medical history and also all of our personal information? These things could come back to haunt us for the rest of our lives. Yeah. 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 And people don't understand it. This gets back to the people that just don't understand.
So here's one. Can't you do a better job updating us? Literally, our lives are in your hands.
Mm-hmm.
And so you're seeing a shift as we move from 4 or 5 days ago to today. You're seeing a shift from panic to anger.
Yeah. And fear.
Mm-hmm.
There wasn't so much fear in the beginning. Now there's fear.
Yep.
And then people continue. Now they're worried about their information. They're worried about their health. Now you are truly creating stress for these people. And
Right.
many of them don't need to be under this kind of stress.
Right. And this is why we say it's about patient care.
Hallelujah.
I mean,
because, here's somebody that's like, it's super irresponsible to not have any backup. Arrogant to think you were immune to a hack. I no longer feel safe with Scripps Health. Why the silence? Just pay the ransom and get back. People's lives depend on it. Okay. Yeah. We know it's not that simple.
No, but I don't know if you looked up under that, but somebody that apparently either works at Scripps or has some kind of insight says, well, they have backup servers, but they were also hacked. And then, it goes on to talk about some other stuff. So somebody's got inside knowledge. And so again, you've got people who are close to the situation who are now responding to people on Facebook. And so you think about that when something like this happens, you want all communication that goes to the public and to the media to flow through one channel. And this is already just so off the rails.
Mm-hmm. And so the last one, 5 days since an update, lack of communication to patients is really inexcusable, even if it's more bad news that the vendor partner is working tirelessly to get this resolved. You guys must have knowledge by now of what has been compromised, and that should be shared with patients and employees, our info and medical records. So you notice there they mentioned employees.
Mm-hmm.
So now the employees are frustrated.
Oh, yeah.
There is no way that any amount of investment in PR this is huge. So if you're the provider of care and you're the one in the community and you're hit, and this Facebook thing, if you're down for 10 days, your patient's going to be on Facebook talking.
Oh, yeah.
And they're going to get terrified if you're not prepared to handle them. And this thing is massive to have. I don't remember how many hospitals it said. Do you? It's 4 main hospitals. It says originally in the article, 2 of the 4 main hospitals and backup servers that reside in Arizona were shut down. Providers and other clinicians are leveraging patient paper records as telemetry has been impacted at most care sites. So you can't get people on the phone. All 4 hospitals in Encinitas, La Jolla, San Diego, and Chula Vista placed on emergency care diversion for stroke and heart attacks. That story from Germany last year, where we said it's official, someone did die because a hospital did that. How long before you think we hear from that?
Mm-hmm.
The website's down, the patient care, everything. They're trying to do what they can, but this is bad.
Here's another problem I see. At some point, somebody, I'm assuming that works at Scripps, says, call this number and for an update. And so somebody responded, well, I have been calling that number. And their response was, just keep calling it every day and check to see if there's an update. My problem with that is you should be driving people to a central location where they can see if there's an update, like a web page or something like that. Don't flood your phone systems with people calling every single day wanting to know if there's an update.
Yeah.
Because that's just going to create more problems.
So the big issue we brought us here was the privacy concerns, and there's a massive amount of privacy breach going on in the beginning of this conversation, and then they just quit replying because people are just pounding away. So there's nothing, and lack of communication is very bad. Unsecured communication, very bad. Employees talking, very bad. It's only exacerbating the situation they're in. So, while some of it is humorous to us, in the beginning, it was. In the beginning, we're like, please don't do this, please. And they did it. Please don't answer. Oh, and they did. But the biggest issue is by the time you get to the end, we truly have panic and fear and concern about life and death over ransomware. So that's why next week we're going to review some updates on ransomware, things like how bad it is getting. That CISA just did a review of a brand new ransomware gang they're tracking called 5 Hands. And we've got to do a better job, people. We've got to do a better job.
Yeah. Yep, we do. And, we've been here for years with the same message. It's about patient care, privacy, security, compliance stuff, all that. It's about patient care. All this stuff is about patient care. This is an absolute perfect example of why you do all those things so that you can provide a level of patient care that people expect and how to respond to these things and have an instant response plans. We're not going to tell you that doing all this stuff with privacy, security, and compliance is going to make you, never get hit with something. It's going to drastically reduce those chances, but you should always be prepared for this stuff to happen.
You should assume that you would be in this position no matter the size of your entity.
Oh, absolutely. Absolutely. Somebody once said the only difference between people who are hacked and people who aren't is that the people who are hacked know about it.
Yeah.
And the people say that aren't just don't know that they've been hacked already or going to, but it's not going to get any better on ransomware. That's not going away anytime soon. And the whole attitude of just pay them further pushes the ransomware gangs and all that to keep doing it. I mean, it's a major, major moneymaker.
Well, and, the FBI is going to say, don't pay them. But the bottom line is, even if you do pay them, we talked about it many, many times. Even if you do pay them, and best case, you get all your data back, how long does it take to actually decrypt all of the stuff? Every single device. It's not like you can't, you have to touch every single device.
Yeah. I mean, that in and of itself is probably days.
Yeah.
If not weeks.
If you're lucky. Something this size, how many devices? Thousands of devices have to be touched by an individual to bring them back to life, even if they paid. And if they paid and they were lucky enough to actually get the data back. So more than likely, they're going to get part of it back, maybe not important parts damaged, and some of it will be damaged.
Yeah. Again, how do you even know the integrity of the data is even there anymore?
Yep.
And what would it take to even try to figure that out?
Yep.
I mean, it's a problem. It's a big problem. So anyway, as you listen to this, I hope that you have a new outlook. If you're the type of person that needed a different outlook on this situation, I know most of our listeners, we're preaching to the choir a lot of times. Most of our listeners are the people that are doing things right and they're taking this stuff seriously. If that's not you and you're listening, get your head out of the sand because this needs to be addressed. If you know somebody who's not doing this properly or who might not be doing these things properly, send them this episode because the only way we can come against these things in a way that's going to make any difference at all is we've all got to take this seriously and take steps in the right direction to start protecting patients.
And make sure that you assume that you need to do this and you have skills and plans in place and hope that you never need to use them.
Mm-hmm.
Because your patients need you to do this. They need you to do this. And we're going to have a link to this feed in the show notes so that you can go read it yourself and see what it says. And I'm sure it'll be, by the time this comes out, who knows what's going to be coming out.
Yeah.
But share that with anybody that doesn't think that patients need to know things.
Mm-hmm. Yeah, and I'm just really hoping that we have no really serious issues or deaths because of this that come out of this.
It is not looking good. It seems quite grim.
Yep.
So I hope those folks do okay, though. I really, really do. Employees, staff, everybody's trying to figure out what's going on, and it's not where any of us ever want to be.
Mm-mm.
So while we like to have some fun, sometimes we have to make sure you understand it ain't all fun.
Yeah, that's true. All right, folks, remember to follow us and share us out on your favorite social media site. I think this is the grimmest we've ever left an episode.
I know, right? You should do something stupid. Go ahead. It won't take me a minute.
Anyway. Yeah, I mean, it's just, people we need them to take it seriously. And we joke about it all the time and that, gets points across and all that. This is one of those times where it's just a matter of, honestly, you get to a point where you really want to just physically pin somebody up against a wall and like shake your finger at them and like, seriously, this is no joking matter, no matter how much we joke about it. You've got to get something done here. These people that, I talk to prospects sometimes and they're like, oh, we're not a target, or we've got this, and
we'll go to paper.
Yeah, if it happens to us, we'll just close down. And it's it's that type of attitude that makes me want to put my foot up their butt because it's ridiculous.
Mm-hmm.
And it would be one thing if it was every so often I see this attitude, but it's prevalent and it just drives me nuts.
Yeah.
So that's all I'm saying.
That's all I got to say about that.
So if you see me in person and you're one of these people that aren't doing it right, you better keep your eye on my right foot.
Told you he could do something stupid, folks. We go. His trick for the day.
I did it. So, all right. Remember, HIPAA's not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.